So friends, here I am again. Recovery is the commonest outcome in addiction. So have hope, have faith, and have trust in yourself. Don't get scared. If you have not been able to recover, then you have hope because recovery is the commonest outcome. I am again Dr. Ashish Deshpande and I am a psychiatrist and an addiction expert. And my passion is to talk about addiction and try to explain and help people in their recoveries. So again, this is the third module that you are showing. Thank you very much for following me on these videos. If you have not seen the previous few videos, my request is that all these videos will make sense if you have seen the previous videos. So my request is that go back to your videos and see the previous two videos before we land up here. So let's recollect what we learned last time. We learned something about recovery, okay, and wanting to recover. And in that we said that, there are other chemicals apart from addiction chemicals that might get affected. So by now, if you are with a therapist or you are in a rehabilitation center, you would have undergone some psychological tests to assess your personality. And if the assessments are done, then ask them what they have found and how it could benefit you in order to prevent your relapse. I told you that emotionality and your coping skills become a crucial part in the relapse, play a crucial part in the relapse that happens. So you have to know your personality. You need to know what thinking patterns are faulty and what wrong defense mechanisms your brain has learned over a period of years, which is making it vulnerable for relapses. So if you have not yet known the results of your assessments, it's time to call your mental health professional and ask him what you rightfully need to know. Now let's try to find out how further we can talk about, understand our recovery. Well, there is a plethora of diseases that can happen. Fortunately, the severe diseases happen rarely. The commonest diseases happen commonly and they are mild ones. Okay, so you have hope. For instance, sleep issues. Okay, most of the addicts complain to me that after stopping the drug of their choice, they are not sleeping well. But believe me, the answer doesn't lie in sleeping pills, because sleeping pills also act on the same receptors that the alcohol acts. And friends, you know something, that 85% of sleep issues automatically get over within the first 30 days of taking a break from the addictive substance. So just have to wait and watch and allow your brain to start churning up the healthy chemicals back again. It's going to take some time, but it's a nice organ. It's a friendly organ. So just believe in yourself, have good physical exercise, eat well, try to sleep well. There are certain things that you can learn from Google called sleep hygiene. And if you read about sleep hygiene, I'm sure you will benefit without having to resort to medication. I'm always wary of giving sleeping pills to people who have drug-related problems. There is a high potential that these pills also could be addictive. So you have to be very careful about what you take as a solution. Otherwise, you will be from the fire to the frying pan. I don't want that to happen to my patients. So let's try to understand that what kind of diseases. See, alcohol can cause depression, anxiety, bipolar disorder, psychosis, maybe OCD, dementia for sure, and sometimes it can lead to convulsions also. So for each of the substances, you can see wherever there is a plus sign, you can have that psychiatric ailment apart from the addictive disorder that you have. And that's the reason why the co-occurring disorders become extremely important, because obviously if you have another disorder, it just means that the brain will not be able to garner enough resources to fight the main problem that you have, that is addictive disorder. So these co-occurring disorders also need to be addressed. It's possible that these co-occurring disorders might require a chemical solution, and that means it is possible that you might have to take psychiatric medicines. Now, whenever I say this psychiatric medicines, people have this expression, oh my God, they have side effects. Believe me, they have very less side effects when you compare it with alcohol and the drugs of addiction. So they are safer, much safer when used judiciously. So the key word here is using them judiciously. You can't be taking these medicines in tons and truckloads. You got to judiciously use these chemicals. And that is where the skills of the mental health professional become handy. So the rule of the thumb is minimum medicines, but right medicines. So if you take the minimum medicines and the right medicines, then it can actually help you sober up even faster. The talk therapy also can help you to sober up faster if you have identified some minor chemical disorders like depression and anxiety disorders. So the best way to do is interact with your mental health professional regarding the co-occurring disorder. Don't let the demons of myths scare you from medication. If the medication is required, take it. Usually it is a targeted therapy. That means it could require maybe 6 months to 8 months to maybe 1 year. In very rare instances, it might require to be lifelong. But what is important that if you have a co-occurring disorder, then for your own sobriety, the co-occurring disorder needs to be treated. Okay? So if you are relapsing frequently and if you have a co-occurring disorder, believe me, there is nothing wrong with your effort, or there is nothing wrong with your willpower. It's the co-occurring disorder that is creating a handicap which is making your journey extremely slippery. So get rid of it and your recovery will happen immediately. So now let's try to understand, well, I have so many friends with whom I used to consume and these things never happened to them, and why am I the unfortunate person? Well, I don't see any reason why you should think that way, but I know that you should know why this has happened to you. Okay, so that's how I try to explain. This is your glass of woe, nothing else. Don't get wrong ideas from me. This is your glass of woe. Now you were born with a genetic vulnerability. Yeah, listen to me right. You were born an addict. All of us could have the genetic vulnerability. And do you know that the genetic vulnerability plays about 40 to 60% role when it comes to alcohol? For each substance, the genetic influence on addiction is variable. But what it does is that it fills your cup of woe, glass of woe. So you can see that for alcohol it is 40 to 60%, for sedatives it is 81%. Okay, so you require that genetic vulnerability, and that's the reason I told you just a few minutes back that sleeping pills is not something that I think of in an alcoholic or a drug addict. For marijuana, it is about 60 to 70%. For stimulants, it is 73%. For psychedelics, you require it to be 100%. Unless that, you will not get addicted. But what happens is that with each vulnerability, there is a filling up that happens. Now, apart from that, okay, there are a variety of things that could fill up. So, social permissiveness that you live, the society that you live in, ease of availability, rules of availability, individual circumstances, information available to the individual when he is making a choice, maybe at the age of 12, 13, 14, 15, 18, 21, whatever it is. Age of brain exposure, okay, well, if you've had a drink at 15, 18 years of age, now nothing can be done about it, okay. But if, okay, so what I'm trying to tell you here is that if once the disease has started, okay, the age of exposure can't be changed. But can you not know something about your soft skills, hard skills, coping skills? You can learn about the disease. And if you learn about the disease and if you learn about the soft skills and hard skills, we are removing some amount of fillings in this glass. And then what would happen is that the froth will not overflow. And when the froth doesn't overflow, it halts this process. And then you have to work on all the other aspects of creating a society which is socially non-permissive. Okay, you have to work on your individual experiences, and you have to keep improving on the information that is available. All these things, when you garner together, then you yourself will realize how to make difficult for you to consume. Okay, it can happen. The big book again says that there comes a time in the life of an alcoholic where he starts seeing a cockroach in his drink. So he understands the craving is there, okay, but when he's drinking at that time, he sees a cockroach. He feels horrible about consuming. So you have to get to that state, okay, where you require to use all the mental resources to prevent yourself from consuming. And that is what we will try to find out, okay, with these efforts. Now, I've told you that these are the things that have changed in your brain. You remember from the first two episodes, the modules that we have seen, right? So let's try to figure out how we can go ahead with our recovery. The recovery is at jeopardy because there are frequent relapses, there is preoccupation with procuring, and the person is willing to take any kind of risk. And that one of the risks is that, I will be able to consume without other people knowing. I will be able to consume in small amounts that other people usually consume. And that risk taking keeps on getting proven wrong. And when that is repeatedly proven wrong, then people say that, he's not a man of good character. He doesn't wish to recover. He is a dishonest person. He doesn't respect his commitments. For him, the family doesn't mean anything. He is a selfish person, self-centric person, adamant person. What all adjectives get stuck on the person who is helplessly consuming. Little did the world know, or the family members know, that the person drinks out of helplessness, and that is something which is extremely pitiable for the person itself. So there could be a thought of recovery, but the person is not able to put it into action. And then that intoxication related behaviors keep recurring, and the person keeps going into the realms of helplessness, hopelessness, worthlessness, to an extent of consuming the drug for the intent of fatality. So the anger towards the person, the mental degradation that happens, the whole spiritual bankruptcy that follows, okay, the person consumes with a death wish. We call it thanatos. Okay, so person keeps consuming with a death wish. So these are the things that need somewhere to stop, and for that the frothing has to be taken care of. Now, what could be the reasons? Why could this person be in this situation? Well, the commonest thing is denial. Now, I hate the word denial. Sometimes I use the word non-acceptance. Does it make a difference? Yes, it does. Because acceptance is not just about accepting that I have a disease, but acceptance is more than that. You have to accept that even if you have the disease, now that you know that you have a disease, you need to accept that you need to do something about it. And if you were able to do it yourself, then you wouldn't be seeing these videos. The fact that you were not able to do something with your own thinking, feeling and behavior, you have sought help. So acceptance is not only about accepting that you have a disease, but accepting that you need help. Now, once you need help, it is not only about stopping drinking or stopping the drugs, but learning how to stay stopped. Now, that part of the treatment also is as important as thinking of stopping the drug. So I've told you that it's a relapsing disease, the road has become slippery. So obviously all the movements that come after that, okay, are going to be, slippery movements. So you have to be extremely cautious about your journey. You can be sober for 90 days, but one momentary lapse is going to take you to an accident. And then what people would see is that not the effort that you have put in for 90 days, but that momentary relapse. You are going to be judged for that momentary slip. And that is very, very disheartening. Okay, so what you have to be is you have to be 24/7 alert. And that is where you have to have acceptance not only to the disease, but these peculiar aspects of this disease make you vulnerable even for people to suspect that whether your motivation is in the right place or not. And then they start sticking labels if the acceptance of treatment is not there. So beware of denial and acceptance. Okay, that could be one of the reasons why the person is relapsing. The second commonest relapse reason is the fear of withdrawal. Sometimes the withdrawals are so strong that they need assistance. They require hospitalization. Most of the times the withdrawals can be done from the residence. Okay, regular phone calls with your doctor, the family physician coming in, a few sessions with the counselors, some few monitorings that you need to do, and you can manage the withdrawals from your own house. But if you keep giving into your temptations and the withdrawals become unmanageable, they become so severe and so scary that they can just put you off your motivation and make you consume, then that can be a cause of frequent relapses. Especially in opioid withdrawals and alcohol withdrawals, I see many people who continue to consume the drugs because they are scared of withdrawals. Okay, so if that is the reason, what you need to do is you just have to jump with a therapy team into the withdrawal scenario, and the detoxification needs to be medically assisted. Believe me, these medicines can reduce your withdrawal intensity by 60 to 70%. Well, you are experienced with withdrawals, so you can manage your 30% withdrawals without much of an ado. But 60 to 70% of your withdrawals could be treated with medication, and then the sailing becomes little smooth and you are open to the relapse prevention plan that probably your therapist will take. The third reason is impulsivity. Sometimes out of nowhere the impulse comes, and before you realize that you need to control that impulse, suddenly you are with the substance. Now that's the worst kind of thing that you can have. These impulses can be instantaneous, or sometimes they can take some time. Now when they take some time, that period I call it hot period. Now what you do in that hot period is extremely important. If you connect, as I said in the previous episode, that if you connect with a counselor or a person who has lived experience of these withdrawals, or you take a cold water bath or eat something like a salad and try to distract, or go for a gym session, it seems to work. Good thing is that talking to somebody about what you are experiencing helps a lot. A 20-minute talk with somebody, continuously being on the phone while you are talking, keep away from all the triggers that you could have, go away from the situation that you are having this thought in. Going away from that situation helps. Okay, so if you find yourself in an impulse, this is what you are supposed to do. The third thing is, it could be your emotionality. So something that has happened in your family, something that has happened in your business, something that has happened in your intimate relationships or friends, anything can trigger this and lead you to a relapse. Now here you need to work with your therapist and learn some skills of cognitive behavioral therapy. So you have to defer the desires, the impulses that this emotionality is generating. Because if you consume the substance that you are trying to go away from, it's not going to solve the problem. So what you need to learn is the emotional management skills. And I'm sure your team of counselors would help you understand the importance of cognitive behavioral therapy and rationalizing your emotionality. If that can't be helped, then maybe they would tell you to take some medicines to control your mood dysregulation. So if you have this mood dysregulation which keeps you relapsing, then the medicines can assist in helping you to control the mood dysregulations, and that would prevent you from going back to the drug. The stress vulnerability. Well, we are alive and we are kicking because we have stress. Okay, so the only way we can lead our life is that to understand that what are the things that are in my control, and you have to work on them desperately. You have to understand what are the things that are not in my control, and you have to tell yourself that you have to live with these things. If they are not in control, there's no other way but to live with them. But which are the things that are in your control and which are the things that are not in your control, you should be able to have a very, very rational way of dividing these things. Because if you are going to force yourself on changing things that are beyond your control, you are hurting yourself. You are banging your head against a mountain, because those are not going to change. The only thing that is going to happen is that your forehead is going to bleed. So you have to decide which things you are going to control and which things you will not be able to control. That way, that the stress vulnerability can be taken care of. And the most important thing in this is knowing about your enemy. And that is what you are doing, and I'm happy about it. So knowing the diseases, knowing the nuances of the diseases, knowing the strategy of your enemy, okay, is an essential part in the whole battle that you have. Now, when you have impulsivity, emotionality, and stress vulnerability, well, I told you that it is called the post-acute withdrawal syndrome. So when these things happen, okay, you start experiencing some symptoms which we label as post-acute withdrawal syndrome, and the acronym for this, I have told you, I''M alkiest. I''M alkiest. Irritability, mood swings, anxiety, low concentration, energy, self-esteem, sleep disturbances, and tiredness. So when that happens, immediately the relapses keep happening. So now, if I have to prevent a relapse, it's simple. What do I need to do? Well, learn about the disease and how to get well. Second, think, change, and accept that you will have to bring about some changes. Be with people who are not permissive. Make it difficult for you to get the substance. Improve your coping skills and say no to drugs. Now, these are the simple things. It might seem simple on the slide, but when you have to practice it day in and day out, minute and minute, sometimes it becomes difficult. And then there is a chance of a relapse. But what is important is that we always say that relapse is a symptom of the disease. So don't get disheartened if you slip. If you slip, what you need to do is that get up and start walking again. That's the way we learn to walk. The first time we set our foot for walking, we did not succeed. So what's the big deal if you relapse? What is important is how soon you gather yourself and start your struggle towards recovery. That is extremely important. I like strugglers because of that. Sometimes in your recovery, you could have phases where you might find it very difficult to maintain your sobriety. But believe me, that recovery is the commonest outcome in addiction. So whenever you relapse, whenever you slip, you just prevent yourself from going back to the whole thinking, feeling, and behavioral pattern that you have with a consumption of alcohol or the drugs. So if you get into that whole pattern, then it takes a long time for you to come back to recovery. So if you have made a mistake, rather than hiding it, just be open about it, share about it, talk about it, take help. That is what is going to help. The death wish is not going to help, because again, you will not get death so easily. So you will have to put in the effort to recovery. So what it means is that if you slip, don't panic, don't worry. What you need to do is seek help and get into the recovery plan, recovery mode, think and feelings of recovery as soon as possible. There is no problem with a slip. There is a problem if you go back to the state that you were before you started your recovery journey. all kinds of wrong beliefs, all kinds of wrong thinking patterns, all kinds of wrong behavioral patterns, if they set in, then you are just going back to square one. So don't allow yourself. You deserve better. And that is what we know from here. So when you start working on these, the recovery starts becoming visible. Okay? One day at a time. When you keep doing it, well, you gain confidence, and what you observe is your health improves, your mind improves, and your relationships start improving. Of course, they improve because you have stopped drinking, but they worsen over a period of time. So they need to get better. Yes, the family members will not trust you. You will not be able to run a marathon, right? But if you work on fitness in recovery, your health would improve and you will be hitting the gym and you would become a center of attraction in the gymnasium or in the race course. What is important is just being sober is not enough. So that is being healthy. But being fit means something else, right? So in relationships also, just stopping drinking is not sufficient. You have to correct the wrongs that you have done and you have to improve upon the way you relate with not only yourself but all the surroundings that you have. So it is about the situations, it is about the family members, it is about intimate partners, it could be brothers, sisters, children, everybody. So how you relate with them is extremely important, because these relationships are important for us, for our happiness. And when these relationships starts giving us happiness, why would you go back to the drugs which give you artificial happiness? So that is essential, and that is what is important. So just being sober, we call it dry drunk. But when you bring about a change in the quality of your life and your well-being, then you are on a strong recovery path, and then you have a road to recovery. So it's not only a tunnel vision that now you are on an open road, and you are fearless. You are not scared of the drugs or alcohol coming back to you. You are on such a stable path that you are not scared of relapsing again. But you have to work to achieve this. And that is what the relapse prevention plan would help. Well, as I said, I love cricket. Okay, so there are multiple cricket grounds that you might have seen, and the pitch, okay, the soil and the pitch decides the bounce and the movement. Right? So Melbourne would have a different kind of pitch and Wankhede would have a different kind of pitch. You can't change the pitch, right? You can't change the climate. So that's the genetics that you have. So genes related to the receptors and the enzymes and the neurotransmitters, you can't be changed. Okay, you are born with them and you're going to die with them. Okay, so the next thing is climatic conditions. They vary. Okay, sometimes it could be windy, sometimes it could be cloudy, sometimes it could be humid, sometimes it could be dry, and the cricketing conditions, batting conditions, the bowling conditions change. Okay, now those are the conditions, we call them epigenetic. Okay, the society needs to understand that it's a disease. The employer needs to understand that it's going to take a long time for people to accept that it's a disease. What is important is that you have to accept that it's a disease and your family has to accept that it's a disease. That is the immediate surrounding. So what part of surroundings that is within our control is the family, the workplace, the attitudes that they have, the supports that they can offer, the awareness and acceptance of this disease and the help that we are trying to give. Now these are the things which need to change. Okay, now in cricketing parlance, it's the 20-20, 50-50 and test match. There are various formats, right? So in these various formats, well, the rules can change. So too in epigenetics, the things that we need to change, the rules will have to change. So the family will have to change a bit. You will have to make a lot of effort in order to change yourself. Okay, so let's restrict ourselves to what I can do and what my family can do. So it is important that in the recovery, it is preferable that the family also is engaged. It is essential. If that happens, then the recovery becomes a double engine recovery. Okay, so that is what is important. So we encourage family members, not because we don't trust you. We trust you completely, and we believe that you are the one who can recover. So you alone can recover, but you can't recover alone. That is what is important. So if your intention is right, then the family supports, the therapy that we offer, everything can become a nice kind of effort which will harness your recovery and reach you to that point even faster. And our role is the last role, the coach of the cricket team. Okay, if there is no talent and there is no intent, the coach is of no use. So our effort is expertise and community initiatives that we do for prevention. The preventive efforts are as important as the curative efforts. Okay, so what we do is that once you are in recovery, we try to engage you in some kind of a community outreach program, which is extremely important because that sets in the patterns for healthy behaviors, moral behaviors that are so very much important for recovery. So that is the reason why the recovery doesn't happen restrictively only in the rehab or in my consulting room or the therapist consulting room. It goes beyond. It goes beyond that arena, and it goes into your society, your local muhallas, your surroundings, your family gatherings, everywhere. And when you talk to other people and tell them your story, it just reinforces your own recovery. It is an essential part of recovery. Sometimes people feel ashamed or embarrassed to share their stories with people because people feel that, sometimes you can have a doubt. There's so much of a stigma associated. Okay, it happens with breast cancer in women also. But now women are coming out. They talk about their problems. They understand that talking in a community just helps. Letting others know about what is the importance of preventive effort and monitoring and awareness, it helps in your own recovery. Now we know that that enhances the body immunity also. So similarly, when you talk about preventive efforts that you should engage in relapse prevention, there are multiple neuroscientific ways, neurobiological ways in which the effort, your engagement with preventive efforts is likely to help. So we'll be talking about it. Till then, enjoy your recovery. It is essential that you enjoy each and every moment of your sobriety. So work on all the other aspects, work on your stress manageability. Always remember that things could have been worse. So if you are not happy in recovery, you have to change the way you think about your recovery. The things could have been worse. You could have been drinking, you could have been having a medical problem or biological relationship crisis, anything. Right now, if you are in recovery, then friends, you are in a much better place. So enjoy the moment. Thank whatever your efforts for being here and keep on struggling. I'm sure things will change in recovery. Thank you very much for watching me, and till the fourth episode and the final module, we will meet soon. Thank you so much.